is Natalie Stephens, and I am a senior 2 this semester of the nursing program of Valdosta State University, which means I will be graduating on Saturday. Following that, on May 18th, I will be taking the NCLEX examination, and if I pass, I will become a registered nurse quickly after that. So during my time at VSU, it's been a 2-year program. I started fall of 2015. We have had the privilege of engaging in a lot of great clinical experience. Our very first semester, we started in the nursing home, and we got to learn things like how to assess a patient, how to do vital signs quickly and effectively, and even medication administration and little things like that. And then the next semester, we moved on to working more in the hospital setting and getting to do more of that medication administration and becoming more independent in our role as we work to become nurses. And then we even got the opportunity to serve in a mental facility. And so that was definitely a challenging place to be, because people deal with a lot of issues and things like depression and suicide and things like that. And so that really opened my eyes, that experience. And then the next semester we moved more into the hospital setting and learned more and more critical care. And then this past semester, what I did my experiential learning experiment on, we have our senior preceptorship. It is a time of 150 hours in the hospital setting. I worked in the nursery at South Georgia Medical Center, and a preceptorship is where you shadow an experienced nurse and you become more and more independent and functioning like a registered nurse will be. So I learned things like IV administration and things like that. So through my clinical experience over the semesters, I narrowed down my area that I prefer as a nurse, and I've narrowed it down to pediatrics or neonatology. And so this past semester I was able to be in the nursery and NICU at South Georgia Medical Center. I worked under a nurse that had about 12 years experience, and so she was able to teach me a lot, like how to insert an NG tube, and a G tube goes down their nose and into their stomach, and so I learned how to do that and how to do feedings, and everything is different on this small little human that comes out early and smaller than even the regular sized newborns. And so that was just an incredible experience. And one thing about a preceptorship is not only do you gain invaluable experience, you also get connections for a potential job, which is also great. So I plan to interview with South Georgia Medical Center. I made a lot of connections there. And so overall, my experience was a great experience, and I feel much more prepared and ready to go out into the world as a registered nurse. Thank you.